Welcome to this program, The Real Truth About Ultrasound for Facial Aesthetics. Let's see if this is right for you and your practice. If you've been looking for an ultrasound, don't buy one till we spend a few minutes together so you can understand what does ultrasound do, what can it do for your practice. We'll show you a couple of clinical applications, and we'll talk about which is the best ultrasound imaging unit to buy. That's important for you because it can save you a lot of money and a lot of heartache. So let's get to the real truth about ultrasound for facial aesthetics. My name is Dr. Louis Malcmacher. I am president of the American Academy of Facial Aesthetics. And there's my email if you have any questions. There's the AAFE's email if you need anything from the AAFE, live patient certification, CME training on Botox fillers, PDO threads, ultrasound imaging, cadaver lab anatomy, and so much more. AAFEtraining.com. You can see all of the best tuition specials for the AAFE, AAFEultrasound.com. That's ultrasound training, the only certification, the real certification on-demand training available with real CME or dental CE, AAFEultrasound.com. We have live patient training. You'll see all the options there. WaveAesthetics.com. We're going to talk about one of the units available, and what's the best one? That's the one we use exclusively use in AAFE training, the Wave FE. It's also available at statdds.com, one of the distributors, and always check AAFEwebinars.com. We've got online trainings all the time, and you can see that all at AAFEwebinars.com. Let's go ahead and see. This is what the AAFE is really all about: anatomy, safety, and technique. And when we talk about ultrasound for facial aesthetics, that's what we're going to be talking about. It's about all three of these things. That's where ultrasound really comes in. It's with anatomy, safety, and technique here. So let's take a look at the questions. The question is, do I need an ultrasound? Is it a toy or is it going to be a tool? Do I really need one if I'm doing injectables in my practice, specifically, or more specifically, dermal fillers for sure? What does it do? We're going to cover all this. What do you need it for? Will it make you a safer injector? I'll let you decide so you can know the real truth about ultrasound and facial aesthetics. What do you need to know first about it? We'll talk about the devices on the market and the best ways to get safety and the best aesthetic outcomes here. And here is what ultrasound can do for you and your practice if you are doing facial injectables. And again, more specifically, dermal fillers, where you can have the bigger complications for sure. And what can you do? You can really help with prevention. The biggest things that you can do are anatomy mapping. You can take a look at your anatomy beforehand. And that's the beautiful thing about ultrasound. Think about ultrasound as a radiograph or an x-ray for the soft tissue, which is what we inject when we inject dermal fillers here. I can find new filler or old filler. That means if it's blocking or it's compressing any of the vasculature, I can go ahead and do guided injections of hyaluronidase. I can do a whole anatomy mapping if I want. Most of the time, when if you want to talk really practically about ultrasound, I think people way overcomplicate ultrasound for facial aesthetics. You don't need a 2-day course to learn all of those things about how to use it practically in your office. No, it's pretty easy when you get to how to use it. The biggest thing is for complications management. So this is your safety net more than anything else, is complications management and managing vascular events and then guided injections of hyaluronidase. That is really the best thing that it can do for you. So we're going to show you some ultrasounds, and just so you start to get the hang of it. Don't worry when you see these ultrasound images, whether you know what's on them or don't know what's on them. That is what comes with training. That's the beauty of ultrasound, and that's what comes with training here. And it's something that we like to call 50 Shades of Gray, because that's exactly what it is if you're looking at an ultrasound. But I'll show you the differences here. But just to get your bearings, if you think about ultrasound as like a cross-section of the tissue you're looking at, so right here, if you look at this, I'll help you read this ultrasound with no problem. Go ahead. The top of the image is skin. The bottom, the whitish part, is bone. And now you've got to know everything in between. This is the piriform aperture space, and so you can get an idea. That deep curve on the corner of the nose, top is skin, bottom is bone. What's in between? You've got dermis, you've got subcutaneous fat. You can have muscles depending on where you are in the face. You can have all of those different things just to really get you an idea of what we are looking at, just to go ahead and start with that. You don't need to know anything else, but I am going to show you some videos. So they're coming up right away here, as you can see. Here's where ultrasound is amazing here. Patient gets injected. All of a sudden, they've got this big bruise. I'll ask you, is that a bruise or is that a vascular occlusion? I mean, a lot of differentiating ways to do this, and certainly in our ultrasound training and in many other AAFE trainings, we talk about complications management, but certainly ultrasound is beautiful at this. Well, with an ultrasound, I can really go ahead and tell. First of all, I can map the patient before, see where the vasculature is, but then when this comes up, is it a vascular occlusion or is it a bruise? I'll let you go ahead and think about that for yourself for right now, but let's go ahead and show you this this video here right here. Let me just get one thing to work. Here we go. Here's a great video for you. Okay, we are going to go ahead and do a little examination on Hazel's lip right before we do a lip enhancement here. And what we're looking for is anything, and you can see on the big screen, we are looking for anything that may look like an artery. Just hold it in one place right there, because here we're going to turn on the colored Doppler here. And let's just go back to the B mode, and now let's go ahead. All the white structures you see are going to be teeth, and now we are going to go ahead and look for the superior labial artery here, and just hold still, Lauren, with that, and that's going to look pretty good. And you can see some of that, and that looks fairly deep. If you see a lot of activity right on top of the white thing, hold still as much as you can there, Lauren. If you see it right on top of the white of the teeth there, you can see, and some of the other things are artifacts, but that is fairly deep. So we're going to freeze this, and here we go. That is perfect. And we're going to measure from the top, from the lip and down, so we know that we are about 3 millimeters away from that, and even a little bit more because I didn't get to the actual top of the lip there, and that is really good. So we've got plenty of room to go ahead and play here and make sure we get filler and not be too worried about superior labial artery. We're always worried about it, but where she's going to inject, as you will see in her lip enhancement, we are not going to have any kind of a problem at all. Measured on that patient, that's not this patient, but I've measured on that patient exactly where the labial artery is, and that gives me a huge advantage. Now back to this patient. How do I know if this is a bruise or a vascular occlusion? Well, what I can do is I can go ahead and put an ultrasound on it. Even after the fact, I'll see the filler that's there. I can then see the vasculature. Is that flow? Is it blocked at all? Or is it not blocked at all? Certainly, I'm going to do all the other things that I normally do. I'm going to do capillary refill test. I'm going to go ahead and take a look at it. But if it is a vascular occlusion or a compression, I can do an amazing guided injection on the patient using ultrasound, so I don't have to flood it with hyaluronidase, which is a big mistake for many, many patients. You don't necessarily have to flood anything with hyaluronidase if you have an ultrasound. That's a huge thing. Ultrasound guided injections of hyaluronidase is absolutely fantastic. So let me show you what it looks like, because we did a demonstration on a chicken breast, and you can really see the use. I'm going to show you, watch carefully as the filler goes in under ultrasound, and then as we go ahead and dissolve it. So here we go. Ultrasound guided injections. That is what makes ultrasound so fantastic here. And here's a little experiment that we went ahead and did just on a chicken breast. It is great to practice on if you want to practice ultrasound guided injections here. Here you see a needle starting to pierce through right at the top of your screen here. And you are going to see that we are going to inject filler into this area, as you will see this happen. Here you see that needle track through right there. There's the filler. That's exactly what freshly placed filler looks like in an ultrasound here. And then if I would put a Doppler on in the B mode, that's what it looks like. If I put the Doppler on, there would be no red or blue because there would be nothing traveling in it. Now, what's amazing about this, let's say this was causing a vascular compression or a vascular occlusion or some kind of vascular event, what we can go ahead and do is we can use the ultrasound unit to go ahead and actually measure how big this is here. And we freeze the frame. We go ahead and go to the measurement, go to length, just use your finger and go ahead and put out your measurements right there. And you can see exactly how big this area is and drag it along. Do whatever you like to go ahead and get that measurement of 1.5 to 2 millimeters in this case of that. Then you go back in and find it again. And now we are going to use a different needle. We actually are using hyaluronidase in this sample here because we wanted to prove and show you what we can do with it. So you hold your ultrasound steady and then you get your hyaluronidase ready to go. And then you will go ahead and you will see that needle come in to right in the middle of that filler. And then you place your hyaluronidase. That's what liquid looks like when you go ahead and place it in there, and make sure that you get it nice and covered here. Now, we did not touch this. Normally, we would be massaging it, make sure the hyaluronidase is getting into all the filler. We didn't touch it. We just let it sit. And now just watch it literally dissolve and see how long hyaluronidase takes to dissolve. It does not take very long. Now, do I need to flood this area with hyaluronidase? Not when I have an ultrasound, because I can literally go ahead and guide it in there. How would I treat this if this was a real vascular occlusion or compression? I saw something happen clinically. I would go ahead and apply some hyaluronidase, not flood it, some hyaluronidase, start to massage it, get my ultrasound, put it in there, see what else, identify the filler, and then go ahead and use ultrasound guided injection so you can put the right amount of hyaluronidase without having to just shotgun it all over the tissue, cause a big mess, and can cause other problems. That's how you use an ultrasound guided injection. Temporal area. This is an area that everyone is afraid of, but you don't have to be afraid if you have an ultrasound. Why? Because there are a lot of different layers there, right? Now, again, let's just orient ourselves. The bottom is bone. That bottom diagonal line is bone. The top is going to be skin. What's everything else underneath there? That is dermis, subcutaneous fat, the different fascias. Fascia will come out. Now, let's just really quickly just give you an idea. Anything that is fluid-filled or has a lot of fluid will come out dark. Anything like bone or smaz or fascia, any of those things will come out more light. And now when you look at this, the bottom is bone, the top is going to be skin. I've got dermis, I've got subcutaneous fat. You'll learn how all of this in AAFE certification training. And then you'll be able to really discern the different areas that you are able to go ahead and see. And it's all about knowing the anatomy too. Ultrasound helps you know the anatomy, but you really have to know the anatomy ahead of time. But let me show you how we're going to use ultrasound on this patient. This is just a little snippet of a top-down temple filler approach that the AAFE has is an exclusive approach that we've developed over time, and want to show you how it's done and how we used ultrasound in the whole thing too, and then we'll go ahead and compare some ultrasound units here. Here is where you will see the power of ultrasound, especially with the Wave FE. This is the next wave of facial aesthetics. We are using a top-down approach for filling temple volume deficiency, the peanut head. This is the AAFE technique top-down approach. How do we know we're in the right plane? Well, that's where we're going to come in and use an ultrasound. In ultrasound, we anatomy mapped this patient beforehand, so we knew what the anatomy of the temple looked like. It's like having an x-ray of the soft tissue. It's amazing, and the Wave FE is an amazingly powerful, small, handheld, cordless ultrasound imaging, and you can see. How do I know that I'm not anywhere near the superficial temporal artery? I don't, unless I really get an ultrasound in there. I can feel in there and get an idea what plane I'm in, but I want to be underneath that superficial temporal artery, and the top-down approach here is one of the safest approaches. Gets even safer when you go ahead and use an ultrasound like the Wave FE here that's made specifically for facial aesthetics. And now we're placing it on the patient here, and let's go to the ultrasound. You'll be able to see the images that it has. It's very simple to use. There's one button. That's how simple it is to use, and it's the most affordable ultrasound and the only one made and optimized for facial aesthetics specifically and for facial anatomy here. So you'll be able to go ahead and see what we're going to look at. Now, we'll be able to see all the different layers. You see those little round holes pop up? Those are sections of the superficial temporal artery, and we'll keep pointing out where that cannula is coming in so you can go ahead and see it, and we can light it up with a color Doppler. This simple ultrasound unit is fantastic. See where the cannula is? It's right underneath it, and this is before I go ahead and inject. I just want to make sure my cannula is in the right plane, and this is going to give me the safest injection possible, and that's exactly where it should be for the best results, and especially the top. You've got to learn this top-down approach by the AAFE. It's an exclusive AAFE protocol. It's amazing. And here's the after, the before and after. You can see on top, peanut head, below, that is filled out quite nicely. We don't want to make it convex because we want to give it a natural shape. And here we can really point it out and you can see it for itself. Ultrasound is the new wave, and it is like having x-ray vision of the soft tissue. You've got to get it. The Wave FE is the best, most affordable ultrasound unit optimized for facial aesthetics and facial anatomy. So make sure you start using this in your practice today. It's really affordable. It gives you the best in safety, not just in the temple area, anywhere else that you possibly can go on the face, and can make you a better injector. And for complications, you can't live without an ultrasound like the Wave FE. So make sure you get one today, and make sure you get AAFE certification trained today. So now let's talk about the actual ultrasound unit that we're using. And we are using the Wave FE by Wave Esthetics, the best handheld color linear ultrasound, and it's optimized for facial aesthetics with the help of the AAFE to really determine and get the most out of this unit. And why do we love it so much? It is exactly what we need it for. Quick precision anatomy mapping, and that's the ultimate in safety. As you've seen, we can manage complications quickly and precisely, and do ultrasound guided hyaluronidase injections and filler injections if you need it. But it is so much better, at least in our opinion, than the other ultrasounds that are on the market. It's very light and easy to hold. It's a stable direct Wi-Fi connection. It's got a great battery, doesn't use any kind of a battery packs that may overheat or shut down, and it's easy to use software. And the image storage uses your iPad, iPhone, and Android device. The software, the app runs on your device, and it saves it to your device. You don't have to use any kind of cumbersome clouds or anything like that. So it really makes it easy for you. And with all that, you can also add on AAFE certification training options. And for a limited time, they are offering $1,000 off, which makes it the most affordable unit out there by a mile. I mean, really by thousands of dollars compared to any of the other units that are out there. But check them all out, and you will see why we really prefer Wave Esthetics and the Wave FE. It is really easy and simple to use for the uses that we want, and that is exactly what we want. Plus, it gives us really good images, as you just saw here. Do I need an ultrasound? The answer is absolutely yes. Quick anatomy mapping, 1 minute. Check to see where you are or where you want to be. Is it a bruise? Is it a vascular event? Now you can tell. Did you dissolve some filler, all the filler, if you wanted to get rid of it? Now you can go ahead and tell, and it's best for safety and aesthetic outcomes. And certainly the Wave FE is the #1 choice for all of that. AV training opportunities, and we've got some great ones for you. Go to AAFEultrasound.com and you will see all of the different courses that we offer. But we've got comprehensive on-demand certification course, 4 CME hours. That may be all that many of you need, and that is what makes it really so special here. We've also got live patient training associated with many of our courses, and when we give some of our advanced courses. So that includes the full on-demand plus live patient training, and that's 8 CME hours. And then we have got our amazing injection anatomy cadaver lab course, which now includes ultrasound training, full ultrasound ultrasound training. So it's the full anatomy cadaver lab, inject and dissect, where you will see 3D anatomy. And in addition to that, it's all part of one big course, ultrasound training, and it is amazing. It's 18 CME hours. It's got all the on-demand for cadaver and ultrasound, plus spending a day with working on cadavers and also anatomy mapping each other, and you will learn everything you need to know about anatomy. When you combine ultrasound and anatomy, that is really the ultimate course for really understanding facial anatomy, injection anatomy, 3D anatomy, and all of those things. So those are the opportunities, and we've got lots of them. You can start immediately no matter what you do, and it's time to really to get AAFE training on ultrasound. And again, it's all just part of really understanding facial anatomy. So make sure you get trained on this today. And definitely follow us on Instagram, Facebook, and YouTube for sure. And all of the AAFE's training you can see at aafetraining.com. We've got all kinds of live patient training of, Botox, fillers, PDO threads, lifting PDO threads, smooth, level 1, 2, 3. Level 1 is foundational, level 2 advanced, level 3 is master courses, master eyes, nose, lips, you name it, cadaver lab training, as we talked about, ultrasound imaging, so much to offer you for that. But ultrasound imaging is definitely, the time is now to go ahead and get with ultrasound training. Here is that slide again where you can go ahead and see them. But if you have any questions, feel free to email me at drlewis@facialesthetics.org or info@facialesthetics.org for anybody at the AAFE. AAFetraining.com for the best live patient CME certification training. AAFeultrasound.com for our ultrasound training, whether it's the complete on-demand CME training, certification training, or live patient, or with our cadaver lab. You'll see all the choices there. WaveAesthetics.com. That's where you go to go ahead and buy the Wave FE. Save thousands of dollars for the best ultrasound imaging unit that's optimized for facial aesthetics. StatTDS carries it as well. And AAFeWebinars.com. We give webinars and online training all the time, and you can see it at AAFeWebinars.com. So thanks for joining us. We really appreciate it. We appreciate any feedback as well, and we will talk to you all again real soon.